It's catabolized in the liver in response to interleukin-6 mediated inflammation. So anytime we see a patient in an inflammatory state, we can be pretty sure that if their CRP is elevated, we know that's a reflection of interleukin-6 mediated inflammation, and we could therefore reasonably hypothesize that they are catabolizing their cysteine in the liver, usually for the sparing of glutamine, and I'll discuss that more later. By this stage of the game, all healthcare providers should be aware of the neuropsychiatric benefits of acetylcysteine and how it modulates glutaminergic neurotransmission. I'm your host, Dr. Alex Vasquez. You can see my information here, and on the following page you can see my notices and disclosures. When I talk about dosages in this presentation, I'm only talking about adult dosages. A lot of the information that we're going to discuss right now is contextualized within my largest textbook, which is Inflammation Mastery 4th edition. You can find out more about this book at various websites, including inflammationmastery.com and ichnfm.org. Inflammation Mastery is still my major book, even though I've derived some other books from it, such as Brain Inflammation, Pain Revolution in Chronic Pain, Migraine, and Fibromyalgia. Also, Human Microbiome and Dysbiosis in Clinical Disease was extracted from Chapter 4, as was Antiviral Nutrition and the paper version of that same book, which is Antiviral Strategies and Immune Nutrition. Inflammation Mastery is really 25 books in one book, and I'll show you how that works out mathematically in just a moment. It's available as a paper book, which usually provides the deepest level of comprehension, but it's also available as a more easily portable and searchable digital book, as you can see here, which enables people to use the digital search feature word for word. Some of my other articles and presentation transcripts are available at my academia page, as you can see here, also on ResearchGate. Video archives have been updated recently and expanded to include 2 new channels on BitChute and Brighteon. As I mentioned before, Inflammation Mastery is really 25 books in one. A typical book has about 60,000 words. Inflammation Mastery has 1.5 million words, which means it's equal to 25 books. So if someone paid $200 for Inflammation Mastery, that would be $8 per section. Again, 25 books, all bound in one book, and again, 1.5 million words. For healthcare professionals, this is, of course, a tax-deductible business expense, and of course, increased clinical talent pays for itself. Please take a look at the earlier 2019 reintroduction to the antiviral strategy. That's available on my website, inflammationmastery.com/antiviral. I've provided some other blogs and journal articles here that you can access if you want some more of the background information. My major thesis presented in this work is that only by understanding viral infections can we prevent and treat them rationally and effectively. If we treat without understanding, then we're just fooling ourselves, and we're mostly throwing drugs at a mystery.